Welcome. This webinar will focus on the American Psychological Association's initiative, Equity Flattens the Curve. Equity Flattens the Curve aims to mitigate COVID-19's disproportionate impacts on marginalized populations around the world, including Black, Indigenous, and people of color, people with disabilities, people with low incomes, older people, and other groups who are vulnerable due to bias. The project focuses on strategies such as reducing bias and stigma, promoting social cohesion and inclusion, and supporting policies and practices that reduce inequity. APA's Gabriel Tooze will explain why inequity is a human rights issue. APA's Kiana King-Chikata will provide an overview of the project, and Equity Flattens the Curve Network member Maisa Akbar will explain how it has informed her work as a practitioner and advocate battling the dual pandemics of COVID-19 and racism. Now let me give you a little bit more in the way of introduction to our three very distinguished speakers, and I think you will find they have much to teach us. I'm Mindy Reiser. I'm a sociologist. I'm on the steering committee of the Science and Human Rights Coalition of the American Association for the Advancement of Science. As I've said earlier, the American Psychological Association is our partner on this webinar, and I will now tell you more about our three speakers. Dr. Maisa Akbar is a groundbreaking psychologist, a best-selling author, a dynamic speaker, and a healer. Dr. Akbar is a thought leader and expert in racial trauma, allyship, diversity, equity, and inclusion. In addition, she is a board-certified clinical psychologist and an assistant professor at Yale University School of Medicine, as well as being the CEO and founder of the Integrated Wellness Group, a psychotherapy practice specializing in treating race-based trauma. Kiana King-Chikata is the Senior Director of Health Equity and Access in the Public Interest Directorate of the American Psychological Association. She is the project manager for Equity Flattens the Curve, which, as we've underscored, aims to center equity in the response and recovery efforts of COVID-19 to reduce disparities and meet the needs and circumstances of priority populations that have historically been marginalized. And Dr. Gabriel Tooze is the Senior International Affairs Officer at APA, where he works to advance psychology globally, with a particular focus on humanitarian and human rights efforts. He represents APA on the AAAS Science and Human Rights Coalition. Now, a quick methodological point. We encourage your questions, and please think of them as the speakers give their presentations and put them in the questions section in your computer. Dr. Tooze will then relay your questions to the speakers, and we will then start with Dr. Gabriel Tooze. So take it away, Gabe.
Thank you so much, Mindy, and thank you to everyone who's tuning in today. I should say that Kiana and Maisa are really our experts here, but since I represent APA on the AAAS Science and Human Rights Coalition, I wanted to spend just 5 minutes or so explaining why the topic of today's webinar is relevant to human rights. And I also wanted to touch on why we see this as a global, not just a domestic issue. Next slide, please. So I know this slide is a bit wordy, but it's important and really underlies the project, so I want to read it to underscore the message. The COVID-19 pandemic is affecting us all, but is disproportionately harming the world's marginalized populations, including people of color, people with disabilities, people with low income, older people, and other groups who are vulnerable to bias. Unless we work together to mitigate these disparities, it will be more difficult to contain the pandemic. So there's an ethical and moral case for what we're going to speak about today. And there's also a pragmatic case. If we don't do this, it's going to be worse for everybody. Next slide, please. So is COVID-related inequality a human rights issue? I think it isn't often framed that way, but I would argue that it indubitably is. As many listeners know, Universal Declaration of Human Rights set forth general human rights principles, and then there are various covenants which make those principles into international law. One of those covenants is the International Covenant on Economic, Social, and Cultural Rights, and Article 12 of that covenant specifies the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. And that enjoyment is clearly threatened by structurally created health disparities, which are exacerbated by COVID, as you will hear. Additionally, the World Health Organization has talked about human rights aspects of COVID, including how stigma and discrimination are exacerbated during public health emergencies. They've argued that human rights guarantees require special measures be put in place to ensure protection from discrimination. And finally, I just wanted to mention that Kenneth Roth, the Executive Director of Human Rights Watch, has pointed out that respect for the right to access healthcare will deter governments from ignoring marginalized communities, communities like low-income people, racial ethnic minorities. I think the extent to which that has actually happened is debatable, but nevertheless, I think it is an argument for the human rights angle of these issues. Next slide, please. APA is an American association, but we have thousands of international affiliate members. We have memoranda of understanding with close to 60 national and regional psychological associations, and we are global in the way we approach these big issues. And we do see Equity Flattens the Curve as a global project. To give just a few examples, we could speak for an hour just on this, disproportionate numbers of South African households considered vulnerable to hunger are headed by a Black person. And these are the households that will be hit particularly hard by an economic downturn. Disproportionate numbers of ethnic minority households in Europe live near incinerators and landfills, and the likely health impacts of these facilities will make people more susceptible to severe cases of COVID. We know overcrowding is more likely to affect particular groups, such as refugees, and these groups have no way to distance from their neighbors or to isolate sick family members, and this could lead to devastating rates of transmission. So reflecting the global scope of this issue, we've had representatives from more than 20 countries in our webinars on this topic, and we have international participants in all of our expert working groups, which I know that Kiana will speak about more soon. Next slide, please. I was going to speak a bit about global stigma and discrimination, and then I discovered that the UN Secretary General, Antonio Guterres, has already done so much more eloquently than I ever could. So Nate, if we could just play about 1 minute of this video. Sounds like we may be having some difficulties with the audio, but at least we can read the captions unless Nate can figure out a way to make this work.
And in the streets. Anti-Semitic conspiracy theories have spread, and COVID-19 related anti-Muslim attacks have occurred. Migrants and refugees have been vilified as a source of the virus and then denied access to medical treatment. With older persons among the most vulnerable, contemptible memes have emerged suggesting they are also the most expendable. And journalists, whistleblowers, health professionals, aid workers, and human rights defenders are being targeted simply for doing their jobs. We must act now to strengthen the immunity of our societies against the virus of hate. That is why I'm appealing.
Thanks, Nate. That's great. I mean, he said it better than I ever could. A tsunami of hate and xenophobia. This is affecting communities all over the world. My final slide here, again, Kiana and Mike are going to say much more about this, but what's psychology got to do with it? Just for a minute, bias, stigma, and discrimination exacerbate viral spread. And that's true for a variety of reasons. We have decades of psychological research indicating that marginalized groups experience chronic lifelong stress due to discrimination in healthcare, education, housing, employment, and this stress contributes to poorer physical and mental health. And we know that poor underlying health can worsen COVID outcomes. And even more directly, ethnic minority populations in the US are less likely to have health insurance. And even when they do access care, factors like inequitable distribution of resources and unconscious bias contribute to a lower quality of care and poorer outcomes. Initial indicators were that doctors were less likely to refer African Americans for testing when they visited a clinic with COVID-like symptoms. And finally, psychological science shows that low-income people are often unfairly blamed for their situations, leading to people being less willing to help them. So it's clear that addressing stigma and discrimination, which is right in psychology's wheelhouse, will be critical to meeting the global challenges of the coronavirus. Next slide, please. Oh, Kiana, over to you.
All right. Let's see. Thank you so much, Gabe, and thank you all for having us. It's truly an honor to engage with you all within the AAAS Science and Human Rights Coalition. This is definitely an opportunity where spirit recognizes spirit in the work that we all are doing. My colleague Gabe from the International Office talked about why APA and why psychology. I'm actually housed in the Public Interest Directorate of APA, where we apply psychology to the fundamental problems of human welfare and social justice and the promotion of equitable and just treatment of all segments of society. We do this through education, training, and public policy. Some of the portfolios in our directorate include aging issues, disability, race and ethnicity, children, youth, and families, women's issues, violence prevention, sexual orientation and gender diversity, and socioeconomic status. The Equity Flattens the Curve initiative also works in concert with our APA Communications Office and Advocacy Office, because while we distill the science and the information as a means of adding synergy to the work that's being done at the local and community levels and coming down in terms of policy, we also know the importance of kind of the message and the framing of the message or reframing of the message, which is important in terms of our communications efforts, and then again, how we have impact on policy with our advocacy office. So in short, the story that I'm going to tell is about the fact that the world's fate around this virus is intertwined. It's interrelated, we're all interdependent, and to overcome it, we must not think in terms of division and separation, but instead a sense of cohesion, oneness, and the fact that we are all facing the same foe and we are all on the same side. As Gabe mentioned earlier, this is absolutely a global issue that we are dealing with. And to be successful, we all have to come together and better communicate, cooperate, and collaborate. We, in terms of globally, are all dealing with the same thing. We're all in the same storm, but we're not, we're in the same storm, but we're not in the same ship. We are all on different vessels. Some of us have yachts, speedboats, canoes, but there are many people who are hanging on driftwood. Some of us have well-stocked reserves, mentally, physically, and financially, while others are operating at a deficit prior to the virus and are depleted of necessary reserves to withstand this said crisis that we're dealing with. Next slide, please. I'm going to talk a little bit about those populations and some of the structural barriers and what we know about those populations. So for instance, here in the US, we know that Asian Americans have been targeted by hate speech and actions in public and virtual spaces. One of the initiatives that Equity Flattens the Curve has is the No Silent Bystander initiative. Right now it's in its beginning stages, and we'll have a summit in January to talk about what that looks like for individuals. What does the field of psychology and other behavioral and social sciences tell us about being a silent bystander? We also know that African Americans and Latinx communities are at a greater risk for infection and mortality, yet they experience significant financial, linguistic, and geographic barriers to access to care. These communities are disproportionately working essential, often low-paying types of jobs. Media reports focus on the heightened risk these communities face due to high rates of underlying chronic conditions. But without educating our audiences about the structural inequities that cause them, again, it turns into us victimizing or blaming the people who are suffering the most because of their circumstances. A lot of focus has been around older adults, which we know is a marginalized group, and they oftentimes lack the resources necessary during many crises. They experience more isolation. They are more likely to need healthcare and community services. We also know that aging services are saddled by racial inequality. And as this sector is disproportionately, it employs and serves people of color. Direct care workers, for instance, are a predominant segment of the aging services workforce that provides daily support to older people and individuals with disabilities across settings, placing them on the front lines of this pandemic and causing a greater risk for being exposed to COVID-19. These low-wage workers, who primarily are women, people of color, and immigrants, often lack paid leave and do not earn enough to weather even a modest disruption in pay. On a daily basis, they are choosing between going to work at the risk of getting infected, potentially infecting others, or staying home and crashing financially. People with disabilities may not be able to physically distance from others or take other protective measures. And similarly, people with low incomes may not be able to physically isolate, increasing risks compounded by challenges such as safe, stable housing, access to healthy foods, and resources to withstand economic downturns. Immigrants face a unique challenge that increases their risk and chances of poor outcomes if infected. Legal immigrants may fear accessing public health or social services in light of the new public charge rule, which is something that's here in the US, and those without documentation may fear detention or deportation. Institutionalized populations, including people who are incarcerated and migrant families in detention centers, also face heightened risk. Therefore, with all of these things in consideration and thinking about this at a structural level, the fact that these are not vulnerable populations, but these are populations that are made vulnerable by the circumstances that are preventable, and that there is actually something that we can do to change those situations. So our country and the world, we're facing a defining moment right now, which we can either evolve or we can devolve. And many of us have been doing this work for some time and feel as though we are always working against the current. But in response to COVID at this global level, we also recognize that the force fields are weakened and that we have an opportunity to have impact and to bring the world along to our re-envisioned new norm, which is centered in equity. Next slide, please. The Equity Flattens the Curve initiative intends to sound the drums and provide the platform to center equity and equitable response and in recovery measures as a form of evolving. That's everyone doing the best they can with what they know and what they have. We are hopeful that we can make monumental evolutionary leaps around this issue of equity and our response. And so how do we do that? We want to inform, so we want to improve key audiences. This is elected officials, community leaders, journalists, about understanding the health and mental health needs of populations, again, that have been made vulnerable. We want to improve key audiences' understanding of how bias, stigma, and discrimination complicate the pandemic response and how to mitigate them. And we want to build social cohesion and tolerance, even as we're physically distancing. We want to use this crisis to move closer to our stated egalitarian goals. Next slide, please. So when we look at the goals of Equity Flattens the Curve, there's really 4 things that we want to do. And the primary one is really connect. It's the idea, again, that we're all in this together. And so we want to connect the voices of health equity, public health, psychology to educate the primary audiences that we talked about earlier in terms of equity and enhancing practices and policies. We also want to reduce bias, stigma, and discrimination, which is what Gabe talked about a little bit. That's a huge contribution from the field of psychology and what we know that impacts people's behavior. I mentioned earlier about promoting social cohesion, inclusion, and equity. We see this as being just necessary and imperative to mitigate the virus's spread, both in messaging and within interventions. And then we also want to promote policies and practices that reduce inequity and address public health needs of diverse populations over short and long-term periods of time. And this is looking at things like safety net programs and the importance of those things. And as budgets start to shrink and we see other kind of financial constraints that happen, those safety net programs begin to be attacked at the political level. And we want to make sure that the voices and the needs of the populations that are at most need are attended to. Next slide, please. So what does Equity Flatten the Curve do? So there are 3 main activities within the initiative. One of the things that we do is we provide a repository of timely and accurate information that has supporting evidence, examples of best practices, advances narratives and news stories, and external links to other resources that advance the goals of Equity Flattens the Curve. So we have what we call a virtual resource center. And not only do we populate that virtual resource center with information that we've collected, but we also invite our more than 800 members, which we call partners globally, to add to that repository of information, again, to inform other colleagues. The who is at the center of the work that we do. We really are focused on building a highly collaborative, constantly adapting network with diverse points of view, experiences, expertise that connects and collaborates, shares resources, learns from, and inspires one another. And then also works together to craft innovative solutions to advance the goals, again, of Equity Flattens the Curve. So we're excited to hear from Maiza, who will be on next, to talk about the work that she's doing, both locally, nationally, and internationally. And then the how that we focus on is we try to provide capacity building processes, tools, and resources to facilitate action through utilization of advocacy and communication strategies. So it's not just enough to give the information, but we actually want to have calls to action. We want to record kind of the impact and the work that people are doing locally, and how can we, when we find successful initiatives that are taking place, what can our initiative do to make sure that we are scaling those interventions for a more broader scope and impact. Oops, sorry, something just popped on my screen. We also want to influence the public, the federal, state, and local governments, policies, decision makers to seed and facilitate activities that advance the goals of Equity Flattens the Curve. A couple more things that I just want to quickly mention. Gabe talked about the fact that, you know, this is a global initiative, and it very much is. And of our over 800 members, we have a large number of international members who are working as a part of some of our subject matter expert groups, who are doing work within their countries, who are sharing the lessons learned that they have, and we're coming together and talking about places where there's room for collaboration, adaptation, so on and so forth. We have people from Ukraine, Nigeria, the UK, Spain, the Dominican Republic, Italy, Philippines. It's actually a quite extensive group. We have Uganda, Pakistan, China, New Zealand, and the diversity of experiences and approaches, again, within the context of the same goals of Equity Flattens the Curve, really makes for rich discussion and rich solutions to different local community problems that we're trying to face. So I think I am over on my time. I'm going to turn it over to Maisa to discuss kind of her work, psychology, what she's doing as a conduit for changing minds and behavior, amongst other things around this issue. So thank you so much. Next slide.
Thank you. Thank you, Kiana, for that introduction. Mindy and Gabe, AAA Science and the Human Rights Coalition for allowing, and elevating this conversation today. I'm a proud member of the network, a practitioner and an advocate, and there are areas that we are tackling on the ground regarding these issues that have really bubbled up as associated with COVID. Next slide, please. So we're going to have a sample of a few of the activities that network members like myself are engaging in. As we know, psychological science is so important to help us really understand how we're going to tackle the inequities that have been elevated through COVID. I'm going to speak specifically about 3 different areas that we are focused on: psychological distress, educational achievement challenges, and law enforcement. What we know at this time is that at least 53% of adults in the United States are reporting that they have been negatively impacted by the pandemic. We are seeing increased levels of stress, and we are seeing that their mental health is deteriorating significantly. Areas that have been affected are panic and increased panic attacks, insomnia, depression is soaring, suicide rates, and frankly, from the first week of lockdown, more than 56% of Americans are describing this as a very stressful situation, with many saying that their psychological distress is moving into a more chronic phase, and now budding into psychological disorders that are associated with trauma, depression, and anxiety. The other area that we have been tackling is this educational achievement gap as a result of distance learning, and the impact to students, particularly in urban environments. That, one of the things that we've seen is that COVID has highlighted the marginalization and inequities that were already present in a lot of these environments. And then now we are seeing that there are challenges around technology, that there is increased parental stress because of having to take care of their children, having to engage in virtual learning with their children, perhaps especially in certain dense areas, limited space. And to Kiana's point earlier, that if you have parents and caregivers that are essential workers, which we do tend to see an overrepresentation with the BIPOC population, then you're bringing another element into the home as well. We are also seeing that certain school districts, at least stateside, can have are reporting that that as low as 30% of students are disengaged from their schooling, and as high sometimes as 70%. So, there's definitely a challenge in terms of continuing to educate children during this global pandemic. In other countries around the world, you're seeing a different approach to education. We actually just had a lively conversation during our United Nations APA representation meeting about how different countries are addressing the educational achievement gap differently than, let's say, some of the states here in the US. The third area that we focus on is law enforcement and the associated racial unrest that's coming along with it. We're seeing that COVID deaths are higher in cities and states that are racially segregated and have heavy police force presence, and that systemic racism and prejudice around the criminal system has led to an outcry for justice through protest. So these, in terms of, as a network member and as a psychologist with boots on the ground, is a way to help this community that's here today to understand how we're using psychological science to combat these issues, and that COVID is not just a virus that we're fighting, but all of the associated inequities that have come along with it. Next slide, please. So let's tackle psychological distress. What are we seeing? We're seeing that many Americans, as I indicated before, are in significant distress and are struggling with mental health issues. We're seeing that, 8 out of 10 adults are reporting significant stress. We're also seeing that there are multiple school closures. In fact, just yesterday, we heard of the abrupt closure of New York school district, the largest school district in the nation. We're seeing that there is significant concerns around children and adolescents and how they are adjusting to this. And that, in terms of the Gen Z population, they're describing disturbed sleep, their consumption of unhealthy foods, lots of weight changes, and in general, significant disruption to their daily lives. Many adolescents and students that are in the pipeline, we're very much looking forward to those milestones that they work very hard towards. Prom and graduation and first year of college, and all of that has been significantly disrupted, and people are still trying to figure out how they're going to adjust to these issues. Next slide, please. So what we've been challenged now as a field of psychology to reimagine mental health in a way that we've never had to do before. Within a relatively short period of time, many of practitioners had to move their entire practices, medical facilities, into a telehealth platform. What we are seeing is, though, that this capacity to be able to do telepsychology and to provide mental health resources through telehealth has actually benefited many clients who had barriers to treatment before. Sometimes those barriers came along with transportation issues, accessibility, lack of childcare. And telehealth has now removed those said barriers and has allowed for more patient contact from that perspective. We've had to completely reimagine the way that we've traditionally done, office visits and having brick and mortar face-to-face therapy sessions, and now having to get used to doing these mental health sessions in using a telehealth platform virtually. We've also seen that psychologists have established continued availability through the promotion of telehealth services, and that many psychologists stepped up to the plate, especially really early on in COVID, providing mental health services all over the nation, globally even, at a pro bono, pro bono, meaning that they were available for people that were going through stressful moments to be able to talk to them about their mental health issues and their distress at the time. And there's also been a great deal of creativity around virtual groups and hybrid programs being formed, and for individuals who typically would have lacked proper resources are now actually receiving them. In terms of international work that's been going on around mental health services, we have seen an increased collaboration in terms of community partners, and that can include faith leaders and other leaders in the community, community-based organizations that are stepping up and providing other types of supportive services. We've seen that there are now peer-led mental health support groups where oftentimes there may be a lack of access to actual psychologists or mental health providers. Now there are more, there's more accessibility in terms of providing this peer-led type of environment, and that there's integration of other types of evidence-based community psychological work, such as psychological first aid. The idea of also training the frontline medical care workers in understanding the psychological impact of COVID has also taken an initiative in the global community. And we're seeing that many more people are understanding that COVID is far beyond just a medical issue, but that the psychological underpinnings are severe. Next slide, please. Now let's talk about the educational disparity that we're seeing. Well, in terms of distance learning, what we're learning is that, there's a significant crisis in terms of new age curriculum. Many school districts were unprepared to figure out how to transition face-to-face pedagogy in terms of teaching and how to turn that into a virtual environment. We are calling it virtual learning and distance learning, but think about this. Many school districts were unprepared and really have never engaged in virtual learning before. So this has been a significant learning curve for many teachers and many school districts as they're trying to support what distance learning is going to look like. And again, we as psychologists are engaging in that conversation in terms of the educational disparities, because we know that the mental health aspects, children with disabilities, children that typically would get those services in school and would be monitored in terms of any, any potential abuse are now not, there's no other eyes on those children. And we're having to support the educational system in how to still service and provide healthy educational curriculum despite these challenges. We're seeing that oftentimes student participation can become very low, and that if they are online, they become distracted very quickly. It's hard to, it's hard for me as an adult to spend 8 hours of screen time between meetings. Children are just the same with their developing brains and their understanding of their executive functions still in development. It's very difficult, especially for very young children, to focus on distance learning, virtual learning for a long period of time. We're also seeing that parents are experiencing a great deal of distress as they're trying to balance many areas of their lives. Parents are reporting that it doesn't seem that there's a beginning or end to their day. They're having to manage, the needs of their children while at home, and at the same time manage the responsibilities of work. What we've also seen is that the most disconnected and difficult area has been in terms of early childhood, getting young children to still be connected or finding appropriate daycare with all of the PPE necessary in order for parents to feel safe to drop their children off in a daycare setting. So many aspects that we are contending with around educational disparities. Next slide, please. So what are we doing in order to reimagine educational approaches? Well, many communities are creating hybrid programs, and they're increasing their access to online tutors beyond just the contact that they're having with their teachers. There are also learning pods that are being created, and we're seeing this in community centers around the globe. We're seeing this with faith leaders creating small learning pods that are safe for children. And we're also seeing the use of libraries in the same kind of way. Many are trying to close the digital divide. You've seen many organizations that are now providing access to a laptop or computer and supporting children as they are trying to still connect online for their learning. And also paying attention to mental health resources now more than ever. And so many children are participating in small group settings that will provide resources for mental health. You're also seeing that there are multi-layered solutions to teaching that are inclusive of both parents and students, and that many times it's a whole approach to teaching children versus just depending on the educational system. In terms of international work, my colleagues over at the UN are engaging in some really exciting work around advocating for early childhood development programs. They're connecting with countries like the Dominican Republic, Mexico, and many others, and urging them to be more knowledgeable about early childhood and the importance of early childhood education, particularly now during a pandemic. And as psychologists, one of the most important things that we're doing is providing research and best practices around this area. So as you can see, for us psychologists, we are embedded in many aspects of our daily living. And education, again, is one of those areas that we are trying to reimagine the way that we do things so that we can remain connected to students and parents during this really complicated time. Next slide, please. The last area that I'll cover in terms of, our advocacy work is around law enforcement and discrimination. What do we understand here is that when it comes to the racial unrest that's happening around law enforcement, and as police killings and COVID-19 death rates are higher among Blacks in the US population, we have had to have a considerable response to what this means. As psychologists, we're tackling the dual pandemic of both COVID and racism. We are equipped to better understand how to support law enforcement in creating higher accountability. We're equipped to help them understand in terms of how to respond to mental health crises in a different type of way. And in fact, this is an area where I was part of a task force in a group that was looking at different layers of police accountability and how we can start to look at the impact of systemic racism and economic deprivation in how law enforcement interacts with communities of color. Next slide, please. So how do we reimagine law enforcement? Here we're really working with a vast research that is looking at the role of police and how that role is ever changing at this time. One of the things that we're looking at is the training that law enforcement receives, yet how does that training match the calls that they get and what they are required to respond to? And what we've highlighted is that there are actually several areas that, in fact, law enforcement is one of the first responders to these areas, but they do not have the training to manage how to deal with these circumstances. And these 4 areas include homelessness or loitering calls, those calls associated with substance abuse, mental health emergencies, or behavioral outbursts in school. Here in Connecticut, there was a article that just came out from the Children's Advocacy Program that looked at one of our districts. And in particular, what they found was that within a 6-month period, there were over 200 calls to law enforcement from just one elementary school to deal with behavioral issues and disability. We want to start to change the way that that response happens through education, psychological science and research, and best practices in this area. Next slide, please. So a new model and psychology's role. We want to, and we have here on the ground, established a new way in which law enforcement can expand their reach and to be supported as they are dealing with crises from what psychologists best understand in terms of first responders. So what we have started to establish is the idea of a call line that will actually deal with these types of emergencies and triage them appropriately. Some will not need law enforcement to be involved, while others are best suited for a medical first responder or a mental health first responder to deal with. We're having mental health providers be more of a support system, especially when dealing with mental health crises. And what we also saw is that the majority of the phone calls that are being responded to actually are related to mental health crises. We're looking at different applications and interventions that can resolve these issues and that can look at communities very differently as opposed to, looking at behavioral outbursts as criminal, looking at behavioral outbursts from the lens of psychology, which then the treatment modality is not criminalized. It actually goes through a series of treatment modalities that help the client or that person enter into recovery, into the treatment that they require and that they need. And then the other piece that we're also looking at is how do we connect to the community? There are so many community-based organizations and resources that can support reducing and minimizing reoccurrences of, of these incidents that will happen. What we understand is that through the knowledge that we have as psychologists, we can impact and impart our expertise on matters such as this, backing it up with decades of research and knowledge to truly create a lasting change. Next slide, please. So, well, this is the last slide. I'd like to now hand it over to my colleague, Gabe, who will help to grab the questions that you may have on the chat, and we'll be happy to answer any questions regarding any of our presentations.
Kiana, could I ask you to turn on your camera? There you are. So the plan was for me to read questions, but I understand my audio is quite garbled. Can you hear me?
I can hear you.
Okay, great. So let's do this. I'll read the question, and in case attendees are having difficulty understanding me, I'll ask you to restate the question before answering. Okay, so the first question is for Kiana. You mentioned that there are 800 members. Can you clarify whether you mean 800 members of APA or of the EFTC network? And I'll build on that and ask, can you say more about who these members are? Are they psychologists, academics, advocates, etc.?
Absolutely. Thank you so much. So the 800 members are the members of the Equity Flattens the Curve, what we call network. And so what we're trying to do is design a space that cuts across not just psychology, but other behavioral and social science and scientists, community advocates, public health professionals, educators, journalists, anyone who really kind of can commit to working towards the goals of Equity Flattens the Curve and who wants to be a part of this cross-fertilization that's taking place. And so that is the APA membership is about, I think, 115,000 members of psychologists, both within the US and internationally. But Equity Flattens the Curve is about 800. And we invite them to partner with us in many, many ways, partner with APA to help just get the word out about the work and the initiatives that they're working on. We want to be able to make connections amongst those network members, again, for synergy and to scale up the efforts that are working in their communities in a more global and just national scope. And so we're really excited about the number of people who have engaged. We are working on a platform right now. Some of you may be familiar with it, and I'm forgetting the name of it right now. But we currently, a lot of our communication is over a listserv, but we are moving to a new platform that'll allow us to categorize the network members so that if you have a strong interest in certain areas, you'll be able to work amongst other individuals with interest in those areas as well. So.
Thank you, Kiana. The next question I see is from Misa. And let me take this opportunity again to encourage others to please write in questions if you have them. How does the current high rate of student disengagement compare to pre-pandemic disengagement? I suspect there is a normal high rate of disengagement, which should require our attention anyway.
Absolutely. I mean, this is just an exacerbation of disengagement, and you tend to see higher rates of disengagement in urban school districts that tend to have, overcrowding in classrooms, not enough teacher resources, not enough after-school programs and other programs that help enhance learning. However, in terms of the disproportionality that I spoke about, with some districts having over 70% of disengagement, that's actually unprecedented. And COVID has really highlighted that. So, this is an area, this is the thing about what COVID has done, right? That it's exposing the inequities that were already there, but we were, perhaps focused on trying to manage so many of these all at the same time. And now we're in a position that, students are simply just not getting what they need in terms of the educational system. And there hasn't been the pivot that needed to happen quickly enough because the resources just were not there. As a personal example that I'll give just really quickly, my daughter, who is currently in an independent school environment, so different than a public school system, what we saw is the way that they approached the educational curriculum was completely different. Both my kids went to public school before they entered into the independent school system, and they managed to be able to have not a hybrid, full classroom participation since August, and she just sort of came home a few days ago. So you see the disproportionality right away in terms of what resources and income does to change the educational experience for children. I hope that gives a broad sort of, but definitely concerted answer to your question around that.
Yeah, thank you. The next question is also from Misa. What is psychological first aid and how do you get training?
Yeah, so psychological first aid can be found in the National Child Traumatic Stress Network. You can just Google that. And essentially the core essence of psychological first aid is that it's an evidence-based, informed, modular approach to help children, adolescents, adults, and families in the immediate aftermath of disasters and terrorism. So it in essence is a way to support traumatic events that that are the result of these disasters, and one can absolutely put the COVID pandemic globally into a global disaster. And what we're seeing is that, in fact, not only are different school districts and other organizations teaching their frontline staff or teaching their staff about psychological first aid, but we're also seeing that corporations are doing so, and that they have a push to teach their staff about psychological first aid and putting mental health first. So I welcome, anybody who is interested in learning about psychological first aid to go onto the website. Again, I'll repeat that. It's the National Child Traumatic Stress Network, and there will be the information on how to get trained on psychological first aid.
Thank you. So I don't see any more questions in the box, so I'm going to take an opportunity to ask a two-part question of my own. The first to Kiana, the second to Maisa. Kiana, can you please tell everyone or remind everyone how they could sign up for the network themselves if they're interested? And Maisa, can you please very briefly, we have about 3 minutes left, to say how it has been beneficial to you?
Absolutely. So there are a number of ways that you can join the network. If you go to our website on APA's homepage, there's actually under the COVID response, there's a webpage that includes our virtual resource center called Equity Flattens the Curve. You can send an email to eftc@apa.org and we can add you to the network that way as well. I'm just going to take this opportunity because I have it to talk about 2 ways that you can engage currently with the network and some of the calls to action that we have out. One is there's a new resource that we just released just a week or 2 ago called Building Community Trust to Improve Participation in COVID-19 Testing and Contract Tracing. And so this is really about how do you improve people's participation around those areas. And it has information about building trust across communities, why trust building efforts are needed, the historical community, what has happened historically in public health around these types of initiatives. What are some of the present day examples of bias and discrimination in health programs? So there's a number of things in this document that you can access, and our goal is to get this information out and let people repurpose it in any way that they want to, and to reuse it, to adapt it for the populations that they are engaging with. We have a number of social media tiles that you can use to help to get the information out to different organizations that can use it. So I want to take that opportunity to offer that to you. And then very quickly, I mentioned earlier that we have a bystander interventions summit coming up. It's January 29th through the 30th. And so that's another opportunity that you can engage if you have, it's all about translating science to action. The purpose of the summit is to identify core components of successful active bystander behaviors across various settings, and also the circumstances that people encounter related to that. If you have an expertise, interest in being a part of that, you can also email that same email address, eftc@apa.org. We have monthly check-in meetings. They're only 30 minutes long, and each of those we talk about a new topic, and then we end with a call to action. So something that collectively the network can go out and do in their local communities. Thank you. Sorry.
Thank you, Kiana. So we're just about out of time. But Maisa, do you have anything you'd like to add very quickly?
I think it's just a wonderful resource for psychologists and other mental health workers in terms of trying to get connected to a amount of resources. And the monthly check-ins are wonderful because you have community there that you can connect to in terms of all of the initiatives. And I think it provides an outlet for us to be able to understand how we're moving forward as we're facing the different iterations of COVID and the various waves that continue to, that we continue to sort of be faced with. So it's for me, I prefer to be in places where there is a network and where I'm not isolated as a practitioner, as an advocate. And this is such an incredible community to be part of. So I do encourage everyone to go right now and get registered for Equity Flattens the Curve. We expect you to be there and we welcome you with open arms.
Great. So thank you AAAS for hosting us. Thank you to Kiana and Maisa for speaking to us, and thank you to everyone listening for giving us an hour of your time today. Feel free to reach out to any of us in the contact information we provided, and I hope you consider signing up for the network.
Thank you, everyone.